The APP Pulmonary Fellowship program at Prisma Health is really the first of its kind at Prisma Health in the Department of Medicine. Our fellow gets a wide variety of learning experiences. They have a slower onboarding period to allow for more time for learning. They aren't expected to see a full patient panel immediately. They get to onboard a bit slower, so they have more time to collaborate with our physicians, learn different disease processes in a stepwise manner that's not overwhelming to them. They also get weekly dedicated lectures for them. We pick a variety of different topics. Each week is something different, whether it be asthma, COPD, interstitial lung disease, or further into the fellowship year, more complicated topics like sarcoidosis or bronchiectasis, some things that you really wouldn't see in your training as an advanced practice provider and schooling. They also get exposure to a lot of different specialties within Prisma Health. So they're getting to partner with our colleagues in oncology or thoracic surgery or thoracic radiology and spend the day with them and learn from those specialists on how they view pulmonary medicine. And that really helps our fellows get a well-rounded experience of what they're seeing in a clinical setting and be able to help educate their patients better because they understand it from multiple different specialties. The fellowship allows them to have more time to be able to have those awesome experiences that really make them a much more well-rounded provider.
The key elements of our fellowship training program are to fill in those gaps in education within our specialty that were not provided when physician assistants and nurse practitioners were going through their master's programs. We want our patients to know that when they come into our offices to be seen and a mid-level provider comes in to provide their care, that they are providing the same care that myself or one of my colleagues would provide to those patients because they have completed this training program under our direction.
Initially, they'll be following our physicians and getting a look at what their day-to-day looks like. Then other days, they'll be working with different specialties to see what their workload looks like as well. I would say 50% initially is going to be in the clinic, and then 50% will be focusing on education. As the year progresses, their clinic time will increase, but we still want them to continue focusing on lectures and still learning. And our goal is by the end of the fellowship, if we've laid out these building blocks, then they'll feel comfortable when it is time for them to be the sole provider and seeing patients with many different diseases and diagnoses.
The initial thing that actually drew me to this program, I was very interested in how much they focus on the education portion. I knew as starting the role as a provider, it came with a lot of responsibility. So it was important to me that I would be supported as a new provider. Working here has really been an incredible experience so far, truly because this patient population is very complex. So although we are pulmonary, it's not to say that we don't manage other diseases because they all are important in caring for one particular patient. So we actually see different patients for many different reasons. We can manage acute and chronic issues. A big program we are also involved in is the lung cancer screening program. We work with a specific population and enrolling them in that program and basically tracking them over the course of a period of time. If I had to give advice to another fellow, I truly highly recommend this program. I have felt so supported and everyone has been really patient with me, allowing me to learn and always willing to teach. And I truly feel like I've been set up for success because they're so great to work with and they're always there for me to answer any questions I have.
We're looking for fellowship candidates that are eager and motivated to learn, because we're going to teach you so much in this fellowship program, and it really is, you get out of it what you put into it. We want our fellowship candidates to want to learn about all the different diseases in the pulmonary world. We want them to expand their education. We don't just want it to stop at work. We want them to continue to learn in this field because in pulmonary, things change every day. And this will set them up for success in the future when they're being the sole provider caring for these patients. So we're looking for candidates that want to go above and beyond.